Do you know why hand hygiene is crucial in healthcare settings? It's the single most important practice to prevent the spread of infections. Here's why. It's a fact of life that our hands harbor germs. Every surface touched, every person greeted means potentially picking up unseen germs. These can easily be transferred to patients, especially those with weakened immune systems, leading to a risk of infection. Healthcare settings are high-risk environments. Hospitals, clinics, and other facilities show a higher concentration of germs due to the presence of sick people and invasive procedures. Practicing hand hygiene helps prevent these germs from spreading between patients and healthcare workers. Moreover, the overuse of antibiotics is leading to the rise of antibiotic-resistant bacteria. Proper hand hygiene helps reduce reliance on antibiotics and prevents the spread of these resistant strains. How do we ensure proper hand hygiene? There are two primary approaches: washing with soap and water or using an alcohol-based sanitizer. Here are the detailed steps to clean your hands properly, as recommended by the World Health Organization. Begin by wetting your hands with clean running water. Then apply enough soap to cover all surfaces of your hands. Start rubbing your hands palm to palm. Next, place your right palm the left dorsum, intertwining your fingers, and then swap. Proceed to rub palm to palm again, but this time with your fingers interlaced. After this, allow the backs of your fingers to meet the opposing palms, with fingers interlocked. Subsequently, engage in a rotational rubbing of your left thumb, clasped in your right palm, and vice versa. Follow this with rotational rubbing backwards and forwards with the clasped fingers of your right hand in your left palm and vice versa. Rinse your hands thoroughly under running water. Dry your hands completely with a clean single-use towel and then use towel to turn off the faucet, thus preventing recontamination of your hands. On the other hand, if you're using an alcohol-based hand rub, apply a palmful of the sanitizer to your hands. Rub your hands together vigorously, making sure all surfaces are covered. Keep on rubbing until the sanitizer dries completely, which should take approximately 30 seconds. Your hands are now safe. So when should healthcare workers perform hand hygiene? Key moments include before and after touching a patient, before performing aseptic procedures like inserting a catheter, after contact with bodily fluids or contaminated surfaces, after removing gloves, before and after eating, and when entering or leaving a patient's room. Remember, hand hygiene is a continuous process throughout your shift. By following these guidelines, you can help keep yourself, your patients, and your colleagues safe from infections. For additional resources on hand hygiene in healthcare settings, you can visit the Centers for Disease Control and Prevention website. So go ahead, make hand hygiene a priority. After all, clean hands save lives.